Hello everyone, welcome back to the channel. Today I am walking you through what a typical morning looks like for me as a dispenser in a pharmacy. So this is just the overview what I do, just print and sort and then check the stock, clear the backlog and close the loop at the end. So I will walk you through with every step one by one. First of all, the day starts once the pharmacist has clinically checked the prescriptions on the system. Normally, the system we use in our pharmacy is called Titan. Once that check is done, my job is to print the labels and then stick them on the paper prescriptions and separate everything into the two piles. One is for small and single item ones, and the other one is for the bigger and multi items. So, this split is just to keep the bench organized as I work through them. Now, a lot of medications aren't the things we keep in everyday stock. There are slower moving items and some are fast moving items. So, for the slow items, if I check the slow stock area at the back and I find it great, I complete that prescription straight away. If it's not there, then I separate it so that it can go onto the order. For the controlled drugs or CDs, we need to do the extra care. So I asked the pharmacist to get it out for me from the locked cabinet area, and they supervise me while the time I am doing it. Once it's done, we double check it together, and then pharmacist places it back in the locked cabinet. No shortcut with CDs ever. Then comes to the old prescription, basically the prescriptions from which one or two items are missing, and we have put the rest of the medications into the bag, scanned them, labeled them, but we have ordered the medication but still waiting for it to come into the pharmacy from the company so that we can complete the prescription. So while all this is going on, I am working through the rest of the dispensing. When most of it's done, I move on to the yesterday's old prescriptions. To do that, I open the delivery, check it against what actually ordered, and match the item to the prescription that were waiting on them, and then those get completed. After the lunch time, I swap with the counter colleague. They take over the dispensing for the afternoon, and I take over the counter so that I will try to cover the counter, serving the patients, handing the prescriptions, but also try to send the text messages to the patients, letting them know their medication is ready, and also storing the completed prescriptions in the labeled boxes filled by the surname. Throughout the day, if a customer comes in and needing the advice, I listen to what they need, recommend a suitable over the counter product, and give counseling within my scope of practice. And if it's something more complex, and I refer it properly to the pharmacist. In the quieter moments, I bring stock from the warehouse and top up the shelves. And at the end of the day, it's all about tidying the benches and giving everything a proper clean before we lock up. So that's a full day in the life of a pharmacy dispenser in UK. Busy, detail heavy, but really satisfying once everything is cleared. Thank you so much for watching. I'll see you in the next video.